Hello, everyone. We are going to give you the Utah market breakdown with Jeff Gaston and Heather Woody. We're going to give you a breakdown on everything that's going on in Utah with each individual plan, and we're going to give you an update on subsidies. Today is October 30th, and we still do not have government subsidies funded because of the government shutdown. Right now, both sides of the aisle have not come to an agreement. We were told when we went back to D.C. in June that to not expect anything till closer to around Thanksgiving. So we're still planning kind of on the same timetable that we were projecting over the summer. But we will say, things haven't looked great.
They have not looked great.
Yeah, not at all. So we do expect there to be some form of subsidies to be funded, and the government eventually does have to open. So they've got to come to a resolution. Hopefully this comes in the coming weeks. We have seen a little bit of traction in the last 24 hours, so we are hoping that something will happen. But we can tell you this, because November 1st is on Saturday, and it starts open enrollment, that we do expect open enrollment to be extended, or we are expecting to have a special election period in the spring. I'm more thinking that it's going to be extended. Wouldn't you say, Heather?
I agree.
Yeah. So essentially what that would be is right now we're the cutoff in February. We're expecting that to go into March to give additional days for people to find a new plan, because they're not going to have the opportunity to have the pricing without subsidies. Now, obviously, if subsidies are not extended, we will not expect there to be a special election period or an extension. But I think everyone realizes that there's going to be some form of subsidies that are going to be done.
Agreed. There's a lot of talk right now about the 400% federal poverty cliff. So a lot of people who have had subsidies in the past are now not going to have subsidies. So that's going to affect a lot of people. So I've heard from several agents here in Utah that they're looking at their rates and are really concerned. So that's definitely something we don't anticipate being addressed. But we do anticipate the subsidies being expanded up to that 400%.
Yeah, and one of our local senators even talked about, hey, $120,000 and above for someone to be receiving subsidies is where they're kind of having the issue with. So we're kind of now thinking, below $120,000 on the income threshold.
Yep.
Now, if you're a single filer and family, kind of look at that on the difference on the numbers. And I think he was more referencing a single filer on getting those. We're looking for there to be some sort of subsidy. So I would still expect people making under $60,000 probably, if there's going to be some form, are going to be pretty similar to where they have been for the last couple of years.
Probably 60, 65, because the federal poverty goes up every year.
Mm-hmm.
So I would anticipate 60, 65 for a single filer.
Yeah,
and subsidies.
And if as soon as we get news out of Washington, we will come back to you with the information and the breakdown on everything. But just kind of give you some numbers and things to tell your clients coming into Saturday that is, hey, we do think there is going to be additional time for shopping. Well, Heather, why don't you give us a breakdown on what everyone's waiting for?
Yes.
The Utah market breakdown.
So let's start with the big news that we've known for several months. First of all, Aetna. Aetna is gone from the market. Good news is that there are other carriers that are going to take over that are going to have a similar network. The bad news is all of those people who are on Aetna, because Select Health is the least cost plan, they are being crosswalked, automatically enrolled into a Select Health plan. So it's going to create a lot of havoc for your clients because it's a completely opposite doctor network, a completely opposite hospital network.
And explain to the people that this plan is being crosswalked because of price, not because of your doctors and hospital network. When they look at it, they're just looking at what premium price is.
Exactly. So they were the closest in premium, so they went out, and that's where CMS is moving their plans. So make sure, if you have not already reached out to your Aetna clients, it's going to be vital to reach out to them, or you're going to lose them because they're going to lose their doctors.
Yeah,
they're not going to be happy with you.
To be clear on that, if you have an Aetna client right now and they're crosswalked over to Select Health, you will no longer be the agent. You will no longer receive commissions on this plan. So you must go in and do if you want to crosswalk them to Select, or not crosswalk them, but enroll them on a Select Health plan, you have to do it as the agent in order to receive the commission, which maybe that's the best option for your client, but you need to decide that as the broker and with your client.
Yep. Next thing across the state that we're seeing, it's about a 14% increase in Utah. We actually saw a much smaller increase in Utah than what nationwide the country saw.
Absolutely.
So Utah's notorious for keeping our healthcare costs low, and saw that again. Jeff already alluded to it, but the open enrollment period runs from November 1st to January 15th. There was a lot of concern about how long it was actually running this year. It's through January 15th. But remember, if they don't enroll by December 15th, they won't have a January 1 effective. They have to enroll by December 15th for that January 1 effective.
Which is really good for people to know. When the big, beautiful bill was being discussed, there was a lot of different going back and forth on what open enrollment was going to be. But for everyone out there, it stays the same as it was the year before. No change.
Yep. Let's talk about the carriers. Our big players in northern Utah, you're going to see Select Health, you're going to see Regents, you're going to see University of Utah, and Imperial. Imperial is a newer carrier to the market. I think they're on their third year.
I believe so,
Yeah, third year. They do have somewhat of a narrow network as far as hospitals and doctors, mostly the Holy Cross network. So you want to make sure you're checking their doctors. But they did have a pretty decent plan this last year and seeing the same thing this year. Next carrier, we're going to talk about Molina. Molina, if your clients are on Molina in northern Utah, you're going to have to move them. And you're not going to be able to write them next year on exchange. They are only off exchange with a paper application. In other words, don't plan on writing Molina in northern Utah.
Yeah, northern Utah, if you have clients on Molina, plan on putting them onto a different plan. And you will no longer be able to write them unless you do a paper app, which I don't know if you would even want to do that, to be honest with you.
Yeah. Also, but in southern Utah,
they're awesome.
Totally different
story.
They are
absolutely awesome in southern Utah.
Yeah, they have full network, so you're going to have Washington and Iron counties. Last year, they led the price in Washington County. They are taking a 30% increase, but they are still a really great option in southern Utah because of their network.
Absolutely. Definitely keep Molina in mind when you're down in southern Utah for sure.
Yep. Next carrier is Regents. So Regents, they are one of the largest. They are statewide. Northern Utah, they're going to be a player, but not real big. Similar network to Aetna, so definitely take a peek at Regents.
Especially if you have some Aetna clients, definitely give Regents a look. Similar network as well.
Our last carrier we're going to talk about is the University of Utah. So University of Utah Health Plans, a lot of people think that they only have University of Utah providers and University of Utah Hospital. That's not correct. They have just about everything except IHC hospitals and facilities.
Yeah, so University of Utah's got an outstanding plan. They have an outstanding off-exchange plan.
They do.
I would definitely take a look at that if you have premium paying clients. Their plan's incredible off-exchange. Plus, for you agents out there, take a look at their bonus. Yes. Oh my goodness, the University of Utah came through huge. I think it's the biggest bonus in the country that I've seen so far.
Yeah, I think $150.
No, $225.
$225. Yeah, we'll send that out.
Absolutely, incredible bonus by the University of Utah. If I would definitely take a look at them this year.
Yeah, you mentioned the off marketplace plan. They do have a $0 deductible plan this year. We've been begging them to introduce it in the market for years, and they're finally doing it this year with a $0 deductible. But I also want to put a plug out there. Check your summary benefits, because a lot of people turn people off from University of Utah because they usually have like a $7,500 or $8,500 deductible. Typically, that deductible only applies in major services. Yeah. So there's still, $40 copays, $90
Definitely
copays.
This year you need to do your research on the plans,
option.
Especially with subsidies and things uncertainty. Why don't you dive a little bit into short-term medical and what options there are in Utah, because I think it's going to be a massive player in Utah.
It is.
And just so everyone knows, Utah is one of the best states for short-term medical.
Yep. I'm going to throw a plug out there real quick for Allstate. They do have a 3-year plan that you can lock the rates in for 3 years.
Which, in my opinion, Allstate has the best short-term medical plan in Utah, hands down.
Yep. And they are also running a Q4 bonus where, depending on how many policies you write, so if you write a short-term and an accident and a dental and vision, which you should be writing, you could get up to a $450 bonus per policy.
Yeah, which is absolutely massive. But that 3-year lock-in is the reason why I think it's one of the best plans. Yeah. And they've told us that Utah is one of their best short-term medical plans. So if you're a broker out there, definitely give them a look. Yep. And if you need a contract, contact us.
Last thing on that, I would definitely, on those people that are at that 400% federal poverty cliff, reach out to them right away in these first 2 weeks of open enrollment, because in about 2 weeks, they're taking a 20% rate increase. Yeah. And you can lock in the lower rates for 3 years right now.
That's very important information
January 1st
right there.
Effective date.
And then the other 2 carriers that have short-term in Utah?
Select Health does have it, and then United Healthcare Golden Rule.
Perfect. Yeah. So if you want to take a look at 2 other carriers, Select Health does have an option for short-term medical, and as well Golden Rule, which a lot of people know is UH1. It's a UHC product. We sell a ton of them on ancillaries and different things with it. They're a really good, reliable company. So great information there. If anyone wants to get into IFP, sell any ACA plans, and you're not contracted, it's still not too late. You can still get contracted, especially if you're a brand new agent. Reach out to us. And if you have any questions about the Utah market, please feel free to reach out to us. That will be a wrap for us. Your quick couple Utah minutes to kind of give you a breakdown on the market. And hopefully we have an update for you soon on subsidies.